Hi, everybody. Welcome to our HAL Clinics, which is Health Optimization and Wellness. Tonight is our community wellness night, and tonight's webinar will be on sleep and sleep hygiene from Dr. Jamie Lee. Just want to let you know that my name is Samantha. I am part of the HAL Clinics team here, along with Dr. Jamie Lee. And we also have our health coach, Claudia, who is actually on board in the vaccines right now. I say hi to you over there, Claudia, and all our other patients. So tonight, we're just going to go through our webinar for about a 30 to 45 minute talk on the sleep. Please write your questions down, or even you can message us questions in the meantime, but we'll follow back post to go over them as we go. So I'm going to hand you off to Dr. Jamie Lee here, who will go over his slides for you and educate you on the world of sleep and sleep hygiene.
Thanks, Sam. Let me share my screen and we can get started here. Okay. All right, so you should see a nice cat there. So tonight's topic will be on sleep and sleep hygiene, and just a guide to better health management. Sleep is such an important part of our life, and really we spend 1/3 of life sleeping, and so there's no doubt that affects all aspects of our health. And so if you truly want the best health, best optimized health, you should definitely look into sleep in general. And obviously that's one of our pillars when you come to our clinic, is that we always talk about sleep and optimize sleep in general, whether it's insomnia or a lot of time it's sleep disordered breathing. So hopefully this presentation will inform you on the importance of sleep and its associations with a lot of conditions as well. And I know we do as a weight management, and so we're going to see how poor quality sleep or sleep deprivation can actually counter our efforts to weight loss in general. So what are our topics, so our objectives to today? We're going to talk about a bit of the hormones that are actually affect our appetite and hunger, because those are affected with sleep deprivation, and also energy expenditure during sleep. We're going to talk about, in general, the role of sleep. You have to understand sleep itself, the physiology of sleep, and a bit of mechanism. So hopefully that kind of highlights kind of some of the deeper parts of sleep. We're going to talk about sleep and energy metabolism. Going to dive into about sleep deprivation and how it affects our appetite and weight gain. And it talks more specific about certain sleep disorders, including insomnia, sleep apnea, talking about optimal sleep hours in general, because there's a thought that some individuals can't get away with 5 hours sleep and work optimally, and that's actually not true based on studies. And at the end, we're going to finish off with tips for better sleep in general. So these are just general guidelines in terms of sleep hygiene. As alluded to previously in our talk in terms of the origins of obesity, there are two main hormones that affect our appetite and hunger, and these are counter hormones. So ghrelin is the hormone that's made in our stomach when we have an increasing ghrelin, typically after a fasting period. It tends to rise in our blood, increases our hunger. And so obviously we know that obesity affects ghrelin over time. And obviously it's inhibited by its counter-regulatory hormone, leptin, which is secreted in the white fat cells. And it's the main hormone for satiety, which is making us feel full. There's other hormones also that are present for satiety. And if you remember that there are a lot more hormones that makes us feel full versus the one main hormone that makes us hungry and want to eat as well. And so that's how strong ghrelin is in general. The other common one that I will mention is the glucagon-like protein 1 with GLP-1. A lot of patients are on this medication, which actually is Ozempic, and that kind of helps curb appetite, hunger, and craving. So I'm not going to get into GLP-1, just more also leptin as it affects our sleep. A little bit about energy regulation. If you guys remember this formula, energy expenditure and balance. And so our total energy expenditure is equal to our resting energy expenditure, which is approximately 65% of our total calorie, so our total energy expenditure. And when we eat food, we require about 10% of that. That's the thermic effect of meals, to break down the food and process it. And our physical activity energy expenditure, which is about 25%. And so, this total energy expenditure does vary with sleep deprivation, chronic sleep, or excessive sleep as well. So it's good to remember kind of how they all play a role together. So what's the role of sleep? And really, it's first of all vital for survival. So you cannot survive without sleep. And so I think the Guinness Book of World Record of the longest duration of no sleep is about 6 days, I believe, 6 to 7 days. And this was, he was a disc jockey, and he did this in Times Square, is in this glass box. And so by the second day, he was actually hallucinating. By the third, fourth day, he was actually having delirious vision and thoughts. And so after that, actually, the Guinness Book of World Record actually did not let anybody try to challenge that record. And unfortunately, that gentleman, the disc jockey, had mental health problems afterwards for life. And so that's how important our sleep is. So you cannot survive without the sleep. And if you go more than a few days, you tend to have a lot of mental health. So overall, it's important for brain health. And the way we learn things and stuff, that sleep is very essential in terms of procedural memory. Basically, that's kind of our memory to do certain tasks and whatnot. As we're learning, I think, for example, if you're learning how to play baseball, you know how to hit a ball, the things that you learn, that's procedural memory. Semantic memory, basically just recall memory. It does a lot of housekeeping. We don't think about the brain as housekeeping, meaning that, there is a lot of chemical processes that go on in there. And so the brain itself does a lot of cleanup of those byproducts, waste products of the chemical reactions. The sleep is also important in terms of hormones. There's certain rise and peaks in hormones that relate to our circadian rhythm, and obviously it affects our metabolism as well. And there are certain times of the day that there's peak metabolism, there's times of the night there's peak metabolism. Different stages of sleep will also affect your metabolism in terms of how much energy you expend through the night. And obviously when we sleep, we don't have control over this. However, having said that, though, if you have more REM sleep, you might have higher energy metabolism. So that's why sleep hygiene and sleep consolidation is very important. So the sleep stages, and so if you've been into my sleep clinic, I talk a lot about the sleep stages when I go through the sleep studies. And you can divide the sleep stages into two major categories: non-REM sleep and REM sleep. REM stands for rapid eye movement sleep. And so stage one, so when you have wakefulness, you kind of drift off into sleep. So as you can imagine, your senses are still more with you. And so you can maybe hear stuff, and our brainwave starts to slow down as this happens. Our heart rate starts to slow down. Our respiratory rate starts to slow down. Our eyes just starts to move very slowly. It's called slow eye movement. And that's stage one sleep. And you're easily awoken from stage one sleep. And after that, we go to stage two, which just takes you a little deeper and is characterized by K spikes on the EEG. And then slow wave sleep, or stage 3/4, we combine it to stage 3 now. And that's your deep sleep. And that's what stage 3 is important in terms of, like, you need stage 3 in order to feel restored. That refreshness that one described, that's from stage 3 sleep in general. And so even if you have 8 hours sleep and you have very little stage 3, you probably won't feel as refreshed as if you had an adequate amount of stage 3 sleep. And REM sleep, we all know REM sleep, this is a rapid eye movement sleep. And so what happens is we lose muscle tone in our limbs. And so our eyes start darting back and forth. This is where we have a lot of the vivid dreams, although we dream in every single stage of sleep, but we tend to have more vivid dreams. And as you go through the nighttime, the durations between the sleep cycles, sort of the REM sleep decreases. So we call REM density increases in the latter part of the night. And typically we do awake from REM sleep as well. So what is the sleep cycle? Sleep cycle is basically one non-REM plus one REM. So you go through stage 1, 2, 3, and then REM sleep. And so we do actually about 3 to 5 cycles of this through the night, and that's our sleep architecture. And you see the picture on the right, that's a typical architecture of 8-hour sleep. So you go through stage 1, stage 4, and back up to REM sleep when we do this. And you can see how the duration between the REM sleep starts to decrease over time as you fall asleep. So this is a normal sleep architecture. So people who have insomnia or sleep disorder breathing, they would stay in the lighter stages of sleep. And so the restorative sense is less, so stage 1 and 2 predominantly, and REM sleep is typically sacrificed. And so there is a biological mechanism that determines our sleep. And so there are 2 main things. And so it is the circadian rhythm, and also the sleep homeostasis. So what circadian rhythm is, this is our biological clock. So we say we have a 24-hour biological clock. It's actually a slightly little more than 24 hours. So if I was to put you in a room, a black, dark room, your sleep pattern would be fairly similar. We have this biological clock. And as a matter of fact, every cell has a circadian rhythm. So every organ, that means the release of certain hormones, right? Chemicals, cytokines, is based on a circadian rhythm. And so if you eat out of circadian rhythm, the body doesn't like that. So you eat late at night, you run into more trouble too as well. And what sleep homeostasis, this is the drive to sleep. This is why we need certain amount of hours of sleep. So if you have sleep deprivation, for example, if you do a night shift, you're forced to sleep to make up that sleep that's lost. So that's called sleep debt, right? And so it's pretty much a 1-for-1, but you don't make it up all in one day in terms of the stages of sleep. It might take you 1 week to 2 weeks to catch up. So if you doing night shift every 3rd, 4th day, so you're going to be chronically sleep deprived for a long time. So that's kind of my lifestyle. Every kind of week I do a bit of call, and so chronically sleep deprivation over time. So there's a lot of things that affect our homeostasis. And so as you can imagine, medical conditions, mental health conditions, medications, our lifestyle. And that's kind of like, the 9-to-5 work world, and we, go out in the evening, stay up later, and then go back to a regular lifestyle and stuff like that. And that's the professional lifestyle. And some people do night shifts as well. So some people do 2 weeks in a row of nights, and they go 2 weeks, and some people do continental shift, which is actually the worst. So the more you transitioned in shift works, the worse it is actually. So these are the 2 drivers for in general. So rhythm, a biological clock in terms of daylight and nighttime, and our need for sleep to maintain the homeostasis. Those are sleep homeostasis. This is kind of the mechanism. I'm not going to go through all this stuff. I don't know all of this stuff. I do know the clock, and also the brain and muscle aren't like protein. So basically, so they were able to basically identify the genes that affect circadian rhythm. So it's the clock gene and BMAL1 gene that creates these 2 proteins, and the rest of the body, metabolism, immune response, you name it. As metabolism, we know that as you fall asleep, your heart rate starts to slow down. Your limbs become more soft, and you lose a bit of muscle tone. Your respiratory rate decreases as well. And as you transition to the different stages of sleep, this becomes more significant. So overall, the energy expenditure decreases by about 15% overnight. And so with sleep deprivation, so as you can imagine, so you're staying up more, you're doing more, there is actually an increase acutely in total energy expenditure, right? And even so for chronic sleep deprivation. So in acute settings, your actual energy expenditure increases as well with chronic sleep deprivation. different, like as I mentioned earlier, different stages of sleep will affect metabolism differently. So in terms of glucose utilization, it's highest during wakefulness and obviously the lowest during non-REM sleep and intermediate during REM sleep. So if we typically have about 20-25% of our night as REM sleep, so 1/4 is REM sleep. So imagine if you have, I've seen people have like, 5%, 3% or no REM sleep. And so then you're cheating yourself out of this energy expenditure as well. So it's important to consolidate sleep, have proper amounts of non-REM and REM sleep too as well. Other hormones are affected during sleep as well. And so the important hormones here I want to mention is growth hormone. And growth hormone, unfortunately, as we get older, starts to decline over time. And growth hormone is that youthful hormones, the teenagers, the early young adults in their early 20s and stuff that have a lot of growth hormones, so have lots of lean muscle mass, right? And so as we get older, this decreases, and so our lean muscle mass starts to decrease as well. And growth hormone is as highest during slow wave sleep, which is deep sleep, which is stage 3 sleep. And if you cheat yourself of sleep, meaning that you delay your sleep time or sleep onset, then you actually decrease the amount of peak growth hormone. And so the peak time of secretion of growth hormone is between 10 and 2 a.m., right? So if you're going to sleep around midnight, 1 o'clock, there's less time for growth hormone secretion. You'll have some secretion, but it won't be as much as well. And so with sleep deprivation, even with about 6 hours of sleep, you have reduced glucose tolerance by up to 40%. So there's no doubt that sleep affects our energy metabolism, glucose tolerance, growth hormone. So a lot of these affect our overall metabolic rate and metabolic profile. So what happens with sleep deprivation and appetite? So normally, when we sleep, there's a marked rise in leptin. So leptin makes us feel full. Obviously, when you sleep, it's a fasted state, right? And so you don't want to be woken in the middle of the night to eat. So that makes sense. So that starts to rise, and your ghrelin starts to drop as well in the latter part of the night, because the longer you go. So for example, if you were to eat a meal, as soon as you start eating the meal, ghrelin starts to go down. But as soon as you finish the meal, after about 30 minutes, ghrelin starts to slowly rise again for the next meal, right? And so, as you can imagine, you want leptin to be high, ghrelin to be low, so that you can actually sleep without getting hungry. So with sleep deprivation, there are low levels of leptin by 19%. That means you feel more hungry in general. So this is seen after only 2 nights of 4 hours or less of sleep deprivation too as well. A lot of times, you'll read some of the articles that they say, well, leptin rises in chronic sleep deprivation. I mean, it makes you full. But the rise in leptin does not mean anything. It's how effective it is. So these leptin hormones that rise in chronic sleep deprivation are actually bind to an inflammatory hormone called, inflammatory protein called CRP, and renders it useless, right? So even though you have high leptins, it actually doesn't work. So with sleep deprivation decreases and increase in ghrelin by 28%. And so overall, basically what it boils down to is that you have increased hunger by about 24% and appetite approximately by 25%. There is a behavioral component to sleep deprivation too as well, and appetite. So patients in the studies that show that patients prefer more high carbohydrate food. And really, once they eat this high carbohydrate food, it's an excess of actually energy needed to maintain energy balance. So basically, there's a homeostatic drive to eat, meaning we eat to maintain a bodily function. So basically, you're eating beyond what the body truly needs to maintain proper energy balance, right? And so as you can imagine, when you have sleep deprivation, this goes on. But when you start to correct your sleep deprivation, things correct itself too as well. The energy intake of high fat foods and carbohydrates starts to decrease. So things do iron itself out. That's why sleep is so important in terms of maximal weight loss. Okay, so as I mentioned earlier, the non-homeostatic food intake, meaning we eat more calories than we actually truly need. And so even with 1 night of sleep deprivation, we have increase in ghrelin as well. As I mentioned, there was higher leptin protein, higher leptin hormone, but is bound to an inflammatory protein called CRP, which renders it useless, right, as well. So orexin is a hormone that makes us feel awake. So when you're awake, orexin is increased. So if you think about narcolepsy, they actually lack this hormone called orexin, right? And so that's why they sleep a lot, right, and have these sleep attacks, etc. Those things. And so what they did in these individuals was that they infused orexin to see what it does to the body. So orexin actually increase our food intake, but also at the same time increase energy expenditure. You're more awake too as well. And we know that indirectly it also affects our hormones that affect appetite, hunger, and craving as well. So so the more you stay up, the more orexin you have, also affects your metabolism too as well. So it's all hormonal driven, these homeostasis faculties. What about weight gain with respect to sleep deprivation? So there is a U-shaped curve of optimal sleep for weight gain. So if you sleep too little, you're gonna have problems with weight gain. If you sleep too much, you're gonna have problems with weight gain. So if you sleep less than 7 hours, the odds ratio, I mean the likelihood of you. So if you have less than 4 hours of sleep, you have a 2.35 likelihood. So more than twice likely to have an increase in obesity. And so typically the average hour of sleep is usually 7 hours. And so if you have 5 hours, you're 1.6 times likely to be obese, right? So the degree of sleep deprivation also affects the degree of likelihood of obesity too as well. In the elderly population, less than 5 hours is associated with a higher BMI. And so unfortunately, men tend to have more problems with sleep associated with weight gain too as well. And even if you had 8-hour sleep and you had sleep fragmentation, meaning that you have small periods of sleep here and there, it's also associated with increase in BMI. Now, the studies for weight gain, BMI, and stuff like that are not causality. They're all associations. So the stronger association, the more likelihood and there's a connection between the two. So I want to make sure that we understand that. And so really in patients who also have insufficient sleep, these are more exact numbers. And so in this kind of study, they said there was an increase of 0.82 kilograms with plus minus 0.47 in weight gain. This is despite the changes in hormone. This is just absolute numbers. And so sleep deprivation, there is definitely a U-shaped curve in terms of how much. So if you sleep less than 4 hours, basically you have a high likelihood of obesity, and beyond 9 hours as well, you have increased obesity additionally. And the mean sleep is between 7 and 8 hours. I want to talk quickly about shift worker and metabolic consequences. Unfortunately, a lot of people do shift work. I do some shift work myself. And so really, when we're doing shift work, we're deviating from the natural circadian rhythm. You're staying up all night when you should be sleeping. And so there's an increased pressure to sleep overall. And so after you're done, sometimes it's hard to fall asleep. But then once you fall asleep, you tend to fall asleep deeper. To make up for the lack of REM sleep, lack of deep sleep that was supposed to be present during the nighttime. And so these patients, we know that they have higher mortality rates, particularly with heart attacks, ischemic heart disease, and strokes. And more metabolically, these individuals, they exhibit glucose intolerance, worsening lipid profile with an increase in the bad cholesterol and a decrease in the good cholesterol, and increasing triglycerides. You can imagine all these kind of metabolic derangement leads to metabolic syndrome, which leads to increased risk of ischemic heart disease, i.e. heart attacks and strokes as well, increase obviously diabetes, insulin resistance, etc. And so that's the consequence of, and this is basically a lifestyle choice. And this is kind of one of those things that affect the homeostasis of sleep. Insomnia is a very common problem And so in the DSM-4s is the way we categorize mental health conditions. And so it's defined as short-term and long-term. So in the short term, it's usually less than 3 months. Chronic is more than 3 months, at least 3 times per week. And so the prevalence of actually insomnia is about almost a quarter to 22% prevalence in society, right? And so a lot of patients, 61 patients, complain of difficulty maintaining sleep. A lot of times, maintenance of sleep sometimes is related to other sleep disorder, so other sleep disorders, including sleep disorder breathing, right? Sometimes people have difficulties with initiating sleep. A lot of times that's self-induced by behavioral. So you want to go sleep earlier to be ready for a meeting, but it's not your typical sleep time, so you have the insomnia. Early awakenings is fairly common too as well. And 25% of patients who have insomnia meet the diagnostic criteria for insomnia, complain of non-restorative sleep, and women have actually more complaints of insomnia than men in general. So is there any consequences with insomnia? You betcha. So insomnia leads to a lot of health risks, and these are just kind of pulled up from some of the studies here. You can see type 2 diabetes, the hazard ratio, I mean, basically the likelihood of you having type 2 diabetes is higher if you have insomnia. So 1.28, 20% higher than someone who does not have insomnia. Dementia, 1.53 relative risk ratio. Stroke, 1.54. Chronic kidney disease hazard ratio, 1.5. So anything more than 1 is considered a higher, you have a higher risk of getting that condition, right? So what about cardiovascular disease mortality, 1.23 mortality in insomnia as well, right? And cardiopulmonary, so the heart and lungs, has a ratio of 2, so twice as likely of something happening together, either cardiac or pulmonary right? So insomnia, even though we complain of, can't get any sleep, can't fall asleep chronically, it actually does impact our health. And you can imagine how it can affect the cardiovascular system with all this glucose intolerance and metabolism issues as well. And so what is the optimum hour of sleep? So the best way to look at that is to look at a big study. And so this is a systematic review and meta-analysis of about 16 studies here. And so in these 16 studies, there was a total of 1.38 million subjects. So pretty good population, obviously massive. And short duration of sleep is considered less than 7 hours. So we can categorize it into less than 5, less than 6, less than 7. Longer durations, more than 8, more than 9, more than 10. And in a similar fashion to weight gain and sleep deprivation, there is a mortality with lack of sleep or excessive amount of sleep. So again, you can see here, if you sleep less than 6 hours, the relative risk of mortality is higher than someone who is between 7 and 8. And so the relative risk is 1.2. So you see the U-shaped curve there. And so there's no difference with respect to age or sex, but if you sleep more than 9 hours as well, so you have problems too. The effect is a little stronger in older cohorts, and so the relative risk is 1.3. So normally we see a U-shaped curve for weight gain with sleep deprivation in patients who have less sleep in general. Have higher mortality. So everything is kind of in the along the same themes as well in terms of health. So too much sleep, poor health, excessive amount of sleep, poor health. And so there is an optimal range. Moving on to sleep apnea, this is what I do a lot. This is a Canadian prevalence study here. So patients between age of 18 and 79. We see that the prevalence, this is between 2016 and 2017. We see that there's a lot of more males who have sleep apnea. And obviously, if you look at the data, more males are overweight compared to females as well, in terms of also the maximum of weight gain as well. And unfortunately, as you get older, sleep apnea tends to increase with age. Typically, the main reason for that is we're less active. We tend to gain weight, our basal metabolic rate starts to drop, or we have hormonal changes, andropause, menopause. All these affect our muscle mass and muscle tone throughout the nighttime as well. And we have other health conditions as well that may affect the quality of sleep. But overall, it's about 6%. I think it's a lot higher than that. I think it's actually 10 to 14% overall in terms of the prevalence A lot of people just don't know, and it goes unrecognized for many, many years. So in terms of sleep apnea, it does affect metabolism, it does affect insulin resistance, and there's a strong association of sleep apnea and type 2 diabetes. And so 50% of patients who have sleep apnea actually have type 2 diabetes. And there's lots of data to show that sleep apnea negatively impacts our insulin resistance, and affects our hemoglobin A1C and fasting glucose level. And that's why a lot of patients who have diabetes, one of the things that general practitioners will do is ask about their sleep. The severity of sleep apnea also correlates with increased insulin resistance, right? And so when we treat someone, we do see that there's improvement with insulin resistance. Now, this is not a direct causality, but there's a relationship. So sometimes we see this, sometimes we don't. And similarly as well, in terms of blood pressure, majority of times we see improvement in blood pressure. And typically because we treat someone and their glucose tolerance starts to improve very quickly. And so with just 2 days of using CPAP, we see there's improvement in terms of insulin sensitivity as well. And the study has shown that the insulin sensitivity improvement actually lasts up to 3-month mark during the study. And so the main reason for this is that when we have a sleep apnea event, what happens is that it's kind of a fight or flight response. Your sympathetic drive goes up. We have increase in catecholamines, which is actually the adrenaline. And then what happens is you have inflammation, we have low oxygen, which further exacerbate things. And so when you take that away, you reduce the sympathetic drive, reduce the catecholamines, improve oxygenation, and reduce the inflammation. So that's why patients do get better. So if you sleep less than 6 hours as well, you're more likely to develop diabetes, twice as likely. And if you sleep more than 8 hours, you actually are more likely to develop diabetes as well. So that's just without sleep apnea in general. I'm talking about in terms of just diabetes alone. All right. So there's some insulin resistance that goes along with less hours sleep and more hours of sleep. And lots of documentations in terms of sleep apnea, how it affects us. Obviously, this is more significant than insomnia. So in terms of cardiovascular disease, you're more than 2 times as likely to have trouble if you have sleep apnea, more than twice as likely to have stroke as well. It is a dose response with respect to the severity of sleep apnea. Sleep apnea also affects our dementia. There's also an increased risk of that, type 2 diabetes and chronic kidney disease. So similarly to insomnia, it's just more severe, obviously, because you're having a lack of oxygen and more sympathetic drive and more inflammation in general. So what are our recommended hours of sleep? And so contrary to a lot of what individuals think, when you're older, you need less sleep or can get away with less sleep. As you can see, after the age of 18, it stays relatively similar, right, to the age of 65. You're needing between 7 and 9 hours, 7 to 8 hours of sleep on average as well. Obviously, children need a little more sleep, and that decreases as we get older. And so, you can get 7 or 8 hours with, broken sleep, but remember, broken sleep also affects our metabolism as well. So it's better to actually have a solid hours of sleep in general. Having said that, these are some good tips for sleep hygiene. So really, you talk about optimizing your sleep environment. When we talk about good sleep hygiene, what does that mean? That means the place should be dark, should be cool, should be quiet, should have blackout curtains if possible. And in terms of sleep routine, keeping it very simple, keep it the same all the time. The body likes rhythm in general. And that means reducing kind of electronics, the blue light, lots of noise, anything that is very stimulating to you as well. Minimize that. And we should use our bedroom just for sleep, or at least our bed just for sleep. And so that trains the brain to say, hey, you know what, when you lay down for the night, you're gonna turn on your sleep hormones. Exercise always improves the quality of sleep, regardless if you actually have sleep apnea. But the important thing to know is that don't exercise just before bed, obviously. It should be at least 3 hours before bed. There is an optimal time to exercise in general in terms of performance, and usually it's early afternoon. It's also important to avoid eating close to sleep time, although sometimes there are individuals who report that they feel sleepy when they eat, obviously because of the blood flow goes to the stomach to digest, and so that's a bit of a change. And there's also some hormonal change that actually makes us feel a little drowsy as well. But it's best to avoid food close to sleep time because it can affect our sleep architecture in general. Remember, there's optimal times to eat, and that's based on the circadian rhythm that we have in every system. The GI system, the kidney system, the cardiovascular system has an optimal time to secrete hormones, etc. And so when you break away from that, then you tend to have more problems with GI issues, etc. Reduce the mental work close to sleep time as well. That helps us calm our brain down. And so a lot of people complain of monkey mind. A lot of times they don't give yourself adequate time away from work. The most important to regulate sleep is your wake up time. And this is where the homeostasis of sleep comes in. And this is the drive to fall asleep. And so if you wake up at the same time every morning and you let's say go to bed 2 hours later than you normally would, well, the body will want to make it up. And so what it will do is it'll make you more tired earlier so you can actually pay off that debt that you lost, right? And so that's very important. So if you want to change your if you want to improve your amount of hours of sleep, what you want to do is just anchor your wake up time. And the body is really remarkable in the sense that the amount of hours you need will depend on your lifestyle, work, etc. Right? So that's important. Mindfulness practice is very important in sleep too, as well. I used to teach people to get out of the bed if in 10-15 minutes they feel they can't fall asleep and their mind's awake. There's lots of studies actually to show that even though if we are able to practice mindfulness in bed, there is actually some benefits with respect to that rather than getting out of bed too as well. So there's mixed data in that. I'm leaning more towards the fact that, being in bed, practicing mindfulness, which is obviously different from letting your mind wander, which often creates more insomnia and more stress and anxiety. And so if you're able to master that, it's actually better to stay in bed and practice mindfulness as well. Because a lot of times you drift in and out of sleep without knowing. And the most important thing, it actually also takes time to change your sleep hygiene. It can take 3 to 4 months as well to correct the sleep hygiene. And so, typically when we want to move wakefulness time, we move about 15 to 30 minutes every few weeks, every couple of weeks, right? So it can take several weeks, 8 to 12 weeks to really affect good sleep hygiene. So that concludes my presentation in terms of sleep hygiene, and how it affects our weight. So hopefully you're able to appreciate the complexity, how important it is for sleep in terms of our metabolism, our behaviors, our energy consumption, how sleep affects different hormones, and different hormones is optimized based on our circadian rhythm as well. And hopefully you can pick up some tips in terms of just correcting your own sleep hygiene in general. So that concludes my presentation. I'll take any questions at this time.
Hi, guys. I'm going to just pause that recording there, and then I will send, you guys can message out on the little chat section down below with any of your questions, and we'll go over them for you. Okay, I'm just going to